Hi, my name's Leanne. I'm one of the midwives at BHRUT Trust at Queen's Hospital. So today I'm going to be talking to you about active labour. Active labour can be defined as when you begin to have contractions that are regular in frequency, strength and duration. Usually, if this is your first baby, it can mean having about 3 to 4 contractions in a 10-minute period for at least 2 hours. And each contraction should last for 40 seconds or more. For some women, it may mean having maybe only 2 to 3 contractions in 10 minutes, so it's really important to just listen to your body. A vaginal examination will be offered to you to assess your cervical dilation. When you are 4 centimetres or more, you'll be said to be in active labour. If your cervix is not yet 4 centimetres dilated, you'll be said to be in the early stage of labour, and even though you may be contracting regularly and frequently. Once you're in active labour, you will be taken to your chosen place of birth depending on your own clinical situation at the time. If you have chosen and planned to have a home birth, your initial assessment will take place at home. During your labour, you'll be encouraged to mobilise and use upright positions to encourage the descent of your baby. If it is not suitable for you to mobilise, or maybe you're unable to due to having maybe an epidural, then the midwife can assist you into getting into some really great positions to try and help baby to come down and rotate and get you going in your labour. You'll be offered internal vaginal examinations every 4 hours in order to assess the cervical dilation and how you're progressing in labour. And along with the vaginal examination, the midwife will also be offering sort of routine checks to check your heart rate, blood pressure, temperature, and also the baby's heart rate to ensure that you and your baby are clinically well. And there's a few different ways that we monitor baby's heart rate depending on what's going on. So the frequency and method of how this monitoring takes place will be according to how your labour is progressing and if there are any other complications to consider. So once you are 10 centimetres dilated, this is also known as being fully dilated, you'll be in the second stage of labour. You may already have the urges to push to birth your baby, and if this is the case, then the midwives can guide you and encourage you to just follow your body and do what it is that it's telling you to do. And if you don't have the urges to push, that's okay. The midwives will give you some time to allow your contractions to continue to build up and let gravity bring baby down and descend that little bit further, so then hopefully you will get those urges to push. And they will work with you and they will work with your birth partner to help you birth your baby in a safe way.